Okay, wonderful. I am going to share my screen and we'll get started. I should have this on full screen mode. If not, Cyril, or if someone could let me know, but okay, thank you so much. Well, welcome everybody. My name is Brian Morales. I'm the chief of the counter-narcotics branch at the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs, or INL for short. This is the first sub-working group meeting for sub-working group 2.1 on data collection, analysis, and trends, including early warning. And it's a pleasure to be here with you. Thank you all so much for joining these sessions. This is the first of many months of meetings that will conclude in September of next year. I want to share just a few administrative announcements at the top. Today's session, this is the third block of programming hour. We have one more block following this. So this morning we covered, or earlier we covered manufacturing and trafficking. And now we are going to start detecting emerging threats and patterns. And then tomorrow we will have our 3-hour block on public health. And then we will repeat these meetings on the 25th and 26th of October at another time for the Eastern region. This is the Western region sub-working group meetings. To the bottom right of the screen, you see an email address, syntheticscoalition@state.gov. Should you have any questions or needs, comments, please email the collective email address at the bottom, and somebody from the INL team will get back with you. Some administrative announcements. Registration for the working groups and the sub-working groups will remain open over the coming year. So at any point, any government or international organization staff member can apply for or can register for participation in the coalition. If you, again, need these links, they are available. You can email us and we'll provide that to you. Additionally, there is a new website for the coalition that is under development, and the presentation from today will all be posted on that website, but we will only record the presentations and we will not be recording the comments section. So following the presentations, we will stop the recording and then we will be posting those presentations on the website. We are also very fortunate that we have the support of international organizations who have identified coordinators to help us as the Secretariat in supporting the organization of these meetings. And so we have coordinators that will be preparing a meeting summary of today's session as well, and we'll be distributing that also through the website. Finally, in the next few weeks, the Secretariat will be sending the meeting schedule as well as the calendar invites to all participants that will cover. We'll give you the schedule for the full year, but also send calendar invites for the next several months so that you have the dates reserved on your calendars for subsequent meetings. And now I would like to discuss a bit of the schedule for the meetings coming up over the next year. This session today is going to be discussing the main thematic issue, how we frame this issue, looking at some of the challenges that need to be addressed related to this specific topic. Then between November and February, we will be having presentations that look at sharing best practices, models, identifying different points of intervention. It's very important that we look concretely what we can do so that we actually start moving forward with concrete deliverables and then have partners here make commitments, either to take on new initiatives or to expand existing initiatives and redouble our efforts to address synthetic drugs. Then around the March timeframe, we are going to be looking at a midterm check-in with the working groups, and we have working group co-chairs that will support us in this endeavor, and you'll have the sub-working group co-chairs reporting to the working group co-chairs the progress of the working groups. And then between April and July, we will have sessions that focus on action planning and implementation, not to complete the implementation, but to get the implementation underway as we move in August to a time of evaluation and transition and ensuring sustainability of our efforts, because the coalition would be coming to an end in September. The final coalition working group meeting would be looking at developing a report and again, reporting to the working group chairs the sort of progress that's been made over the course of the year. But when we discuss sustainability and transition in August, we really mean that we are starting a process, making some gains, but then also continuing through other channels, through other organizations and other processes, the work that gets started here over many years to come. So we're hoping that this coalition will be a catalyst to stimulate a lot more engagement of more partners and more sectors within our countries to look at this very complex issue from a multifaceted perspective, and then to intensify our work also over the coming years. I'm going to stop sharing now, and I'm going to now introduce, we're very fortunate to have two international organization coordinators that are supporting the work that we are doing within this sub-working group. And so I would like to introduce both of those colleagues. So we have on one side, Bryce Pardo, and he is a social affairs officer working in the Research and Trends Analysis Branch at the United Nations Office on Drugs and Crime, UNODC. And then we have Hernan Epstein, statistician also in the Research and Trends Analysis Branch at UNODC. So I'll turn over the floor to them so they can provide their welcome.
Thank you very much, Brian. Unfortunately, Bryce couldn't make it today, but I'm here. I'm here to help. So good morning, good afternoon to everyone. My name is Hernan Epstein, and I will be the coordinator, like Brian said, together with Bryce, who unfortunately couldn't make it. We both work in the Research and Trend Analysis branch here at UNODC in Vienna. Personally, I am a statistician working on drug statistics now for over 6 years. And part of my job is to manage the annual report questionnaire, which I think some of you may be familiar with, which is the main UNODC global drug-related data collection, and also to coordinate the data side of the World Drug Report, our annual flagship publication. In this sense, my work covers a wide variety of different topics within the drug universe, such as supply, demand, criminal justice system, national framework, etc. So it's a pleasure for me to be here, and I really look forward to following the discussions in this very important group, and also supporting the work ahead. Thank you very much, Brian.
Thank you so much, Hernan. Point taken on Bryce, but I do see that the chief of the branch, Angela May, is here on the line. So I also want to turn it over to her for her welcome.
Thank you, Brian, and warm welcome to all of you from Vienna. You will hear from me later on the presentation.
Thank you. Thank you so much. Now I want to introduce the two co-chairs for this sub-working group 2.1. We'll start off with Dr. Charles Perry. He's the Director of Mental Health, Alcohol, Substance Use, and Tobacco Research Unit at the South African Medical Research Council. And then following his introduction from Canada, we have Benoit Archambault from the Drug Analysis Services of Health Canada. So Dr. Perry, over to you first.
Thank you, Brian. Just like to introduce myself. I've graduate training in mathematical statistics and psychology from South Africa and the USA. I'm a member of the WHO expert panel on drug dependence and alcohol problems, and also the scientific advisory committee of the UN World Drug Report. And I see myself as an alcohol drug epidemiologist and policy analyst. In 1995, I first attended a meeting of the International Epidemiology Work Group on Drug Use in Vienna, a long time ago, and the next year established the South African Community Epidemiology Network on Drug Use. And that year, I also did an evaluation of what was then the UNDCP International Drug Abuse Assessment System, IDAS, which led eventually to the establishment of the annual reports questionnaire, which was mentioned just now. Our South African network has been running for 27 years. It was modeled, as I said, after the US Community Epidemiology Work Group, and we collect data from over 100 drug treatment centers and community harm reduction services. At times, the network has included data from various other sources, including police forensic science labs, trauma units, mortuaries, sewage plants, and interviews with drug users. And we've also provided support for setting up drug epidemiology networks in 13 Southern African countries. Some of them are still continuing, and also in West Africa. and I welcome this opportunity to co-chair the sub-working group with Benoit. Thank you.
Thanks a lot, Charles. Yeah, my name is Benoit Chambaud. I'm from Montreal, Canada. So I'm the National Director for the Drug Analysis Service in Health Canada. So our goal here is to provide support, analytical support, actually, to all law enforcement agencies across the big country of Canada. So it's up to over 100,000 samples a year that we receive in our 3 laboratories located in 3 different regions in Canada. So in Montreal, Toronto, and Vancouver, the 3 big cities in the country. So yeah, we are specialized in analyzing those substances to report on the result, to be able to for law enforcement to follow up with court cases. So we have a lot of expertise. We are generating a lot of data. So I think it's very nice for that particular meeting about data collection and sharing, because we try to do our part and to post as much as we can, to share as much as we can for different purposes, not just for enforcement purposes, but also for health purposes and harm reduction initiative and stuff like that. So we are very proactive in that regard. So I'm very pleased to be one of the co-chair for that meeting. I'm looking forward for all of your participation, involvement, and yeah, we're looking forward for next step as well. So we know that we have a very tight deadline. We have to stop for my time at noon to flush, so it's 45 minutes from now. So without further ado, let's start with our first presenter. She already quickly introduced herself, but I will do it properly. So our presenter is Ms. Angela May, who is the chief of the Research and Trend Analysis branch at the UNODC in Vienna. And the topic of our presentation today will be on a global landscape and challenges. So Ms. May, the floor is yours.
Thank you, Benoit. And thank you for giving me the opportunity to tell you, to talk to you about the challenges that we have at, at all levels, from local, national, and global level in terms of data and knowledge. So I start by sharing my screen. I hope you can see it.
And we can see the screen, yes. And you may also want to move your presentation into the slideshow. Thank you. Yeah.
Okay, great. So I will start. What I will do, I divided my presentation in 3 parts. One, to say, what would we like to have? So data and knowledge for what? What do we need holistically? And then to discuss a bit, where actually we are, maybe a bit far from this ideal structure and framework that we will need. And then to close, hopefully, maybe with some optimism. So I will start by saying, so what are the information need? Possibly everyone online today here in the subgroup deals with data, knowledge and information. So why? And I see that basically there are 3 areas where really we, as researchers, statisticians, data, we need to provide. One is on the size and the patterns of a synthetic drug phenomenon, also on the harm of a synthetic drug phenomenon, but also on the response by the state or other type of responses that we have in relation to the synthetic drug problem. And this across many areas, demand, supply, markets, across health information system, criminal justice. And for what? Well, in a way to describe, but also to predict. So not only to describe the phenomenon, but also to look ahead and think about the threat ahead in order to prevent it. And also to understand the impact of drug policy. So all of this in a slide, in a way, what we would need. And if we go a little bit down, I have divided, you will hear a lot about demand and supply. You know well that sometimes this divide is a bit artificial because many of the topics, issues, data, they cut across. But, overall, if we keep this, as you can see, There are a lot of data point, information, indicators that we need in these areas. I will not go through all of them, but hopefully, the presentation can be shared, or you can have a flavor just looking at it. But just to see the magnitude and the different level of information that is needed for the demand. The same is for the supply, a bit of a different nature, but again, it has vary very widely on the information that we need. But it's very important also that we see this information not in isolation, because drug phenomena are complex, they are transnational, and also trust, if you want, they go across different areas. So it's important that the knowledge is constructed not only at looking at this as a single point, but also to look them together. And here is an example of the importance of triangulate this information. And so bringing together also, if you want, the classic demand and supply. And if this is just an example that, for example, seizure data, we know that alone can, say both whether there is a change in the supply or if there is a change in the law enforcement capacity. And it's not easy to disentangle these two elements if we just look it together. But it's when we triangulate, for example, seizure with purity, with consumption, with price, then we are able to understand if trends are relating to an increase or a decrease of supply. And I just wanted to give you an example with a graph there that we have in the global cocaine. It's not a synthetic drugs, but it's to make the point. And there you see different indicators that when they are together, they clearly indicate a changing point in the market. And here is the example of the Western and Central Europe, where really all of the, as you can see, purity, consumption, seizures, all together, they can indicate what turning point when the market is starting to expand. The same is, in looking at, together those single points, and that could be the example of seizure, but also of the different indicators. And, to look from individual events to, put them together, link the events in order that we understand the pattern. And, again, here is the example. This is the map that also Mike showed earlier from the World Drug Report. And is the example of when we put, for example, individual seizure information across countries. And so here the importance also of looking at this single points across countries, we can really understand the patterns and the trend. For example, this is Captagon. But here in another example of the graph here on the right, again, usually using individual seizures and using characteristics of the people arrested, put them together. You see that, for example, here, the continuum is the amount of seized drugs. And you see that the different nationality, also the different groups associated to large-scale trafficking, you see on the right, to middle-level distribution and detail and retail level. And you see how the groups change. And so certain groups, again, this relates to Europe, certain groups are more associated at the lower level of the scale, others are much involved in the big scale of the trafficking. So again, going back to, looking again at this idea, bringing all of this information together and really having an holistic view of understanding the drug, the harm, and the response will require an amalgamation of many sources. And here I'm not going to go through all the sources, but you see that is a combination of health administrative records, of population surveys, of law enforcement, criminal justice administrative records, forensic toxicology labs, but also financial intelligence units, early warning system, wastewater analysis, and then also the pink one are in a way the one that are less probably traditional from the drug sphere is the private sector, and that is particularly important for synthetic drugs, but also banks records, internet and social media records that really can help to understand how trafficking relate, but also trade and production of statistics on chemicals are very important. Even the illicit trade, and comparing, for example, illicit trade with seizure, it really helps to understand how the precursors better, how to tackle the precursors. In this holistic set of all of these sources, clearly, it would be important that these sources are comprehensive. So, many, for example, of the administrative records often are not comprehensive. So that there should be national coverage, that they are comparable, that there is linkage across these sources, that, data included in these sources are properly disaggregated for the subpopulation groups that needed more or less attention, that this data provide timely information, but also that these sources give data accessibility, so that the sources gives proper availability of data, that when coupled with analytical and statistical capacity, we can bring all together this information and, to really describe the drug problem. But from this, again, holistic idea, where are we? And so in terms of, we have looked at globally at the availability of some of the key indicators, just to have an idea on, availability global. And you see that, for example, these are what you see in the slide, the percentages of indicators that have been reported in the annual report questionnaires. So the data that countries reported to us. And you see that some of the supply indicators are more available, are almost widely available, seizures. Across all countries, but also that, and also price almost, around 80–70%. But that, for example, the detection of clandestine laboratories is available in much fewer countries. And you see that the demand, the indicator related to demand, are much less available than, for example, seizures. You see, for example, availability of national data on people in treatment, about 60–50%. Drug-related deaths, again, less than 50%. And the annual prevalence, and that is, if you want, the gold standard indicator to understand drug use in a country, is really available in a very few number of countries globally. The criminal justice indicators are a little bit more available, but still not clearly not comparable as the one, for example, of seizures. And it's also important to look at the disaggregation. And so, sex disaggregation is still not universal in many of indicators. And here you see the example of, the difference between the black, that is the reporting, and the green, that is the percentage of the reporting data that are sex disaggregated for both demand and criminal justice. But also to see, for example, here is an example of Africa. And here is the example of improvement of the data actually that we have at global level. And you see that the dark blue is the data series that we had that are sex disaggregated, and for the different type of collection. And you see how in a way, the dark blue has been increasing in different, in 2 time period. And so showing that actually it is increasing, but still is not universal. Now, overall, why do we have this lack of less, availability? And it's really a multitude also of challenges. And it's hard also to, speak about all of these challenges in a few minutes. But there are some challenges that are overall. Political will is definitely one of what we see often. The political will really to understand, to invest in data, but also the political will of sharing data. And this is not only at international level, but it's also at national level. The political will to share data across national institutions. It would be great to hear also from the audience, their experience. But also the lack of coordination at national level of, bringing all of this information together. And a lack of, mostly in all countries, a data governance policy. an issue of sharing, of access to information, of respect to privacy, and that the agenda of data governance is expanding very quickly across countries and in different areas. For example, in the health area, there is a lot of work. But in terms of the drug area, this is really something that, in a way, is still probably lagging behind in many countries. But you see that there are also, challenges for particularly the demand side indicator, for the supply. For the demand, particularly the population surveys that gives this golden standard data on drug use are expensive. And in many countries, self-reporting of data is challenging for stigma, but also particularly for synthetic drugs, because people don't always know what they're taking and what to report. And the names of the data of the drugs that are taken by various, they are very local. So it's hard to capture also in population survey, but also the lack of international standards that we have on population survey outside of the Western. How do we ask people how they use drugs where drug use is so highly stigmatized? But also from the supply side, there are certain areas that are particularly weak. The price information, but also the seizure, and particularly for synthetic drugs, this is relevant for identification, because while if you want the traditional drugs law enforcement are quite equipped to identify them, for the new drugs, for that are particularly synthetic drugs, there are challenges in identifying them, and so it's hard to actually report on seizures. But, let me maybe focus on some of these challenges talking about early warning systems. And, the early warning system function when there is actually a very solid data point, the data that underline early warning. And these are typically from laboratory, forensic laboratories, but also health providers, for example, hospitals. And so the data in early warning are as strong as those basic sources, laboratories and health are. But also there are issues with the sensitiveness of data. Some of the data that comes from the early warning system are still going through cases. And so again, what I was mentioning earlier in terms of data governance, often there are no agreement across institutions how to treat the data and how to use it. But there are also technical challenges and in terms of identify the substances, but also in keeping and recording the data in a way that then this data can be used statistically. But these challenges are really, as I was saying earlier, at different levels, from the local level to the national level and to the regional and global level. From a local level, clearly there is often low digitalization. And so many countries, the reporting is still manual, non-standardized. And so in a way, if a seizure is not recorded at the local level, will never reach the national or the global. But also at national level, there is in many countries, there is the lack of coordination and the lack of bringing all the information together to understand the threat. Not just describing the current problem, but to understand the threat. And if in Latin America and also in Europe, there has been, in a way, a culture of bringing together drug observatories at national level. In Africa, this is a concept that is still lacking behind in terms of bringing everything together. And then, from the national level at a global level and regional level. And then, the gaps in a way that they are at local and national, and then of course they are reflected at global level. Not only there are gaps at this level, but also every time that at each level reports at a higher level, there are also gaps and challenges in the reporting. But I wanted to conclude with, in a way, a positive and encouraging message. This is the map with the reporting to the annual report questionnaire. Again, an indication also of the political will of countries to really share data in a collective way. And the graphs that you see there, this is the latest reporting for 2021. Now we are collecting the data for 2022 that will be published next year with the World Drug Report in 2024. But you see there interesting the bars so that show an increase in the reporting of RQ. And last, I want particularly to acknowledge the increase that we have been in the reporting in Africa, and particularly for Western Africa, and see that really for us really showed that investing in developing and helping countries to bring together all the information that they have at national level, and then helping also the international community and all of us at the global level, so that we can have a full picture and understanding of what we have in front of us that continue to be a transnational phenomenon for which we need transnational data. So thank you. Back to you.